And thank you for coming back again. We have taken a week's hiatus and revamped some of our topics, but I wanted to continue to complete our topics related to pregnancy and then move into the postpartum period and breastfeeding. So, tonight we're going to talk about vaginal birth after cesarean section. A lot of women want to know, can I have my baby vaginally after I've had a C section? And the resounding answer is yes, most definitely yes. As per the American College of Obstetrics and Gynecology, their guidelines for vaginal birth after cesarean section, otherwise known as VBAC, between 60 and 85% of women can have a vaginal birth after cesarean section. So, what I'd like to do tonight is to review some of the reasons why cesarean section was done in the first place, and then look at what we're needing to know as we move forward with another pregnancy and want to have our baby naturally. So, here we go, one more time with my slides. It's a great way for me to stay on point and to be sure I'm getting the most important information to you. So we're going to move forward. I want to also say to you, I've been getting a number of people viewing my videos. I so much appreciate that. My goal is to be able to have those who are viewers to also be subscribers. So if you're liking the content that I have been providing, I'm going to ask you to like, to subscribe, and then to also share with your friends and family. So let's look at some of the reasons. I want to get myself out of this. The biggest reason and the most prominent reason for why cesarean section is done is what's called prolonged labor, or it would be called failure to progress, meaning that you have not made adequate progress in your labor. And so therefore it indicates that you may not be able to have a vaginal birth. And that is the primary reason for why cesarean sections are done. I want to say that there have been changes in regard to what is considered active labor and how you would manage and take care of you in labor prior to active labor and after. At one time, it was thought that active labor might be once you around 4 to 5 centimeters dilated. But the definition now is 6 centimeters is when active labor actually begins. That means that early labor, or what is called prodromal labor, can take up to 24 hours, and that is considered normal. And how one would manage that is in an expected way, helping to provide you with comfort, keeping you hydrated, and trying to work with your body or let your body do its work until we get up into active labor. And it's not until active labor and then what the progress is after active labor that one could then begin to say that there is a rest, or the labor is stopping, or that you have prolonged labor. And there are other definitions that I will share with you in another video or in a short as to what is should be done for prolonged labor. So I want to also say to you that this is the time in regard to informed consent. I want to emphasize again and again, please keep the informed consent for cesarean section as a separate consent form over the general pre-admission consent forms that you sign prior to admission or upon admission to the hospital. Other reasons for cesarean section is if the baby is in an abnormal position, such as breech or transverse lie, fetal distress, birth defects. It's no longer repeat cesarean section, once a cesarean section, always a cesarean section. There are reasons that could prevent that, but we know that up to 85% of women can have their baby naturally after cesarean section. If there's a chronic health condition, if the cord prolapses, we talked about that in the previous video, and whether or not there is cephalopelvic disproportion. These are the reasons why cesarean section is being done. Also understand that with cesarean section, there are risks. There's an increased risk of cardiac arrest, meaning heart attack, during the postpartum phase. Wound hematoma, hysterectomy increases. The more cesarean sections that you have can increase the need for hysterectomy. There could be major infection after you've had the baby, complications from anesthesia, blood clots, hemorrhage that can require that a hysterectomy be done because we cannot stop the bleeding. So it's done to save your life, and of course, a longer hospital stay. But here's the good news, that 60 to 85% of women, as I've mentioned before, can have their baby vaginally after 1, even after 2, and sometimes 3 cesarean sections. And so don't let that cesarean section stop you from a vaginal birth. You then have to get some other information to help verify what happened as to why was the first cesarean section done. And also, what is the scar, not the scar that you see on your skin, on your stomach, but what is the scar on the uterus? And most times, cesarean section is done with using a low transverse incision, meaning that it's a low incision way below the navel, above the pubic bone, where that incision started on the uterus. We need to know, why was a cesarean section done? And through numerous studies that have been done, most of the time it's for what is called fail to progress, or this prolonged labor, meaning that, your active labor did not move as it was supposed to. But again, those parameters have been reviewed and updated. So you want to become very educated, know yourself. We've talked about knowing yourself as to why was that cesarean section done in the first place. And then to mentally prepare yourself. If you had cesarean section before, you don't have to get scheduled for another cesarean section. Prepare yourself to go into labor. We know that women who go into labor on their own have the best success with a vaginal birth after cesarean section or VBAC. So what would be done? What would be done during labor is to give you what we call a trial of labor, to see whether or not you can have your baby on your own. There is some complications or contraindications that occurred earlier that would stop from wanting to do this trial of labor. That would be if there was a classical up and down incision on your stomach that went from the top down, okay? If that type of incision is on your uterus, not on your stomach, but the uterus, then that would be a reason to not do a vaginal birth after cesarean section. If for some reason there was a surgery for, say, fibroids or any kind of surgery on the fetus, the incision done on the uterus could be a T-type or a J-shaped incision. That would also be a contraindication for vaginal birth after cesarean section. If there is an incision in the top half portion of the uterus, not the lower segment that we talked about before, but in the top part of the uterus, that would be a reason not to move forward. Or if there has been a history of uterine rupture with a previous labor. The thing of it is that we know that uterine rupture is only about a 1% indication if there has been one previous cesarean section. If there have been 2 previous cesarean sections, then that risk of uterine rupture goes up to 2%. But still, that's between a 98 and 99% chance that that will not happen. So don't be afraid of uterine rupture because you have had a cesarean section in the past, unless there's a history of a previous rupture or the things that we have talked about before. So during labor, what would happen to you during labor? The preference is for you to go into labor on your own. That would be preferred. If you don't go into labor on your own and you reach the point of beyond 41 weeks, then and the cervix is not ripened, meaning that the cervix has not begun to open up or to thin out, then sometimes there is the need to help to ripen the cervix. It is not indicated, it is advised not to use things of oxytoxic such as misoprostol or dinoprostone. So you want to know exactly what they would be planning to use if your cervix did not begin to soften, open up, and thin out on its own. Things that would be okay to use would be a very low dose of Pitocin or oxytocin dripped through your IV, or other things such as balloons to be able to ripen the cervix or help to open up the cervix if it has not already begun to soften up and open up and thin out on its own. During labor, you can expect to need to wear the fetal monitors continuously, again, because of the concern for uterine rupture. Uterine rupture happens minimum amounts of times after you've had a cesarean section. We're talking anywhere about 1% if you've had one cesarean section, and then 1 to 2% if you've had 2 or more cesarean sections. The signs of uterine rupture would be an increase or decrease in the uterine contractions, severe labor pains that are very different than contractions. These pains would come from blood that is collected in the abdomen, and that would be what the pain would be from. It would be a big amount of blood that has collected, and also the uterus has opened up. And that, depending on where it's opened, it could have affected the placenta as well. A sudden loss of where's the fetal station, what we call where's the baby's head in location to the spines on the pelvis. And if there's blood in the urine, these would be signs of uterine rupture. The things that we want to say would be the risk for future pregnancies when you have continuous cesarean sections. We've talked about this before in a previous video, that when you have more cesarean sections, it's an increased risk of what we call placenta previa, and then what's also known as placenta accreta, where the placenta embeds further in than it should, and its ability to detach is very, very difficult, and it could result in excessive amounts of bleeding. Therefore, a hysterectomy would need to be done. So this is the information to provide you on vaginal birth after cesarean section. Again, this is very possible for women who have had a cesarean section before. Anywhere between 60 to 85% of women can have a vaginal birth after they've had a cesarean section. What good news! And it's something to really consider and advocate for. And so these are things that you want to ask your healthcare provider that you are employing to give you information about. It's something to look at for the hospital where you plan to deliver for vaginal birth after cesarean section. It is required really that you have your baby in a hospital, as they are more prepared in case there is the need for cesarean section. I hope that you have found this information to be helpful. I want to let you know that I have dropped my free ebook. I will place the description for and link for where you can get the free ebook. It talks about the reasons why women of color are dying in the United States and gives the root causes. Also, as I always say, if you like my videos and the content that you have been receiving, please like, subscribe, and tell your friends, your family, tell your sisters, your brothers, your aunts, your uncles, your daughters, your nieces, your nephews. Let everyone know. Thank you so much for your time again this evening, and have a great week. Happy birthing for those who are expecting babies. Thank you so much. Bye-bye.